When the time comes to start a family, the main concern for potential parents is that their baby is born healthy. Couples with a family history of hereditary genetic diseases run the risk of having a baby affected by these diseases. Hereditary genetic diseases are caused by a small change in the DNA contained in the genes. These changes in the DNA are called genetic mutations and can pass unnoticed down through the generations. There are several factors which increase the risk of transmitting a specific genetic disease to the future baby. If the prospective parents already have a child affected by a specific genetic disease, if the parents are carriers or have been diagnosed with one of these diseases, or in case of family history of a genetic syndrome. Pre-implantation genetic diagnosis (PGD) is a test that can be performed during assisted reproductive treatment and allows prospective parents to prevent an incurable genetic disease before pregnancy. PGD can be used to analyze DNA from each embryo in an IVF cycle to check for the genetic mutation which causes a disease. PGD identifies unaffected embryos, which will be transferred to the uterus so that the baby is born free from a specific genetic disease. The PGD test consists of 4 easy steps. The couple's genetic risk will be assessed by a doctor. A blood and saliva sample will be taken from the prospective parents and other family members if necessary. For each couple, a customized diagnostic test will be developed. At the fertility clinic, once embryos are produced, an embryo biopsy is performed, which involves extracting a cell sample from the trophectoderm, the part that will form the placenta. The sample is transported in a special container to the iGenomics laboratories, while the embryo remains at the clinic. At iGenomics, the laboratory will analyze the samples and create a report detailing the genetic status of each embryo analyzed. The PGD report helps the doctor and patient decide which embryos are suitable for transfer. PGD testing greatly improves a couple's chances of having a child unaffected by a specific genetic disease. The same embryo biopsy sample can be used for additional analysis, PGS or pre-implantation genetic screening, which can help determine those embryos most likely to implant and produce a healthy pregnancy. Specifically, PGS detects alterations in the normal number of chromosomes of the embryo, increasing implantation rates, pregnancy rates per transfer, and decreasing rates of miscarriage. At iGenomics, we can perform PGD for most monogenic diseases. Please consult your doctor or contact us for more information.